Started here. Okay. Welcome everyone. This is Dr. Clark in the Center for Weight Loss Success, and tonight on Losing Weight USA, we're going to talk a little bit about estrogen, estrogen dominance, estrogen deficiency. How can it affect you? We talked a little bit about menopause last week, and so subsequently then this is a kind of continuation of this, so there'll be a little bit of background that'll kind of repeat itself, if you want to call it that. Then we'll talk about a little, this is more of kind of perimenopausal type of thing, not the actual menopause itself, but hormones are very important. We kind of hit on that all the time. All right, and I'll give the official welcome. Welcome, Losing Weight USA. Answers to your weight loss questions, as well as some of the latest updates in research, as well as a little bit of expert advice. That would be me. Gives you direct access not only to me, but you should be receiving the health tips and recipes via the membership portal. Each webinar is going to last about 30 minutes or so. If you have questions, just type them in during the presentation. At the end, we'll kind of go back and answer those questions. If you think of something once we're all done, just give us a yell here at the Center for Weight Loss Success. Email is success@cfws.com. Phone number 757-873-1880. All right, let's get started here. I'm going to flip the screen over here. There we go. This is one of my favorite slides anyway. Hormones. That's what we're talking about. So kind of, and they affect lots of different things. And with any hormone, balance is absolutely key. But with estrogen especially, balance is key. Because estrogen does affect weight tremendously. We kind of mentioned that last time. Now, just to give a little background, what are hormones? Hormones are basically chemical messengers. That's all they are. They're chemical messengers that send a message from one organ to a different organ. And so it's communication. It's a way to communicate between body parts. So they're chemical messengers between one part of the body to another. Now, when the hormones, or when the hormone organ, okay, sends out this hormone to the tissues, only the tissues that have receptors for that hormone are going to respond to that hormone. It's kind of that lock and key phenomenon. So like just say, we'll talk about estrogen since we are talking about estrogen. So estrogen is made by the ovaries. So the estrogen is released. It travels all throughout the body. So it's not like it only goes one spot. It's like, no, it travels through the bloodstream throughout the body. And subsequently, though, it's only the tissues, though, that have receptors to that estrogen and that can actually respond to it. So they're the ones that will receive the message. The other places that if they don't have estrogen receptors on it, subsequently then they won't receive the message. And typically then, whatever the message is, that message will be turned on. So in different tissues, the same estrogen may actually have a different response to it. And so it's not necessarily the same thing that is occurring at every single end receptor. So, but you have to have the receptor on that tissue in order, and if there are receptors on that tissue, there is a reason those receptors are there. So that hormone is telling that tissue to do something. Okay? And it is kind of that lock and key phenomenon then. So hormones are one of the main tools your body uses to maintain homeostasis, which is basically balance. So hormone balance is a key concept, and it's true with literally every hormone that we talk about, every hormone in the body. You want to have it balanced. So estrogen is a sex hormone. All the sex hormones are derived from cholesterol. The sex hormones are progesterone, estrogen, testosterone. Okay, but they're all derived from cholesterol. Kind of goes back to the cholesterol discussion, is that we can't live without cholesterol. And part of the reason is because you have to have cholesterol to make some of these hormones. So the sex hormones again includes testosterone, progesterone, estrogen. Estrogen, actually, there are three types of estrogen in the body. Estrone, which we refer to as E1, estradiol, which is E2, and then estriol, which is E3. Now, we kind of talked about these last time, but both men and women share all of these hormones. The only difference is the actual numbers and kind of the absolute and relative amounts of them. is that for like testosterone, women need testosterone just like men do. Well, estrogen, well, men need estrogen just like women do. It's just much smaller numbers, and the actual absolute numbers are much different between the two, but everybody requires them. It's not like, oh, that's only for men, only for women. It's like, no, it doesn't work that way. So again, estrogen is the primary female hormone. Okay. Now, both the adrenal glands and the ovaries can produce estrogen. So just keep that in mind. It's not only the ovaries, but the adrenal glands can too. Now, estrogen has about 400 different functions in many different tissues. So again, if there's 400 different functions, that it's kind of sending the estrogen throughout the body, there are many different tissues that are actually responding. It's not just your uterus or just, there are many things that are actually responding. So the estrogen receptors then are also widely distributed throughout the body. You got them in your brain, the breast tissue, bone, blood vessels, the reproductive organs, they're throughout the body. And there might be slightly different messages that are actually turned on. So it's a chemical messenger that goes to the receptor on a different tissue, and subsequently when that hormone connects on that receptor, a message is produced, and a message to do something. There will be a response to that. And kind of that's the real question is, okay, what's the response in the different tissues, and are they responding appropriately? So adult women, again, have the three primary estrogens. Estradiol, that's the most important one. Estrone, much less important, and estriol. Estriol is mainly important during pregnancy. All right, so we kind of talked, or I mentioned kind of earlier, we're talking really about estrogen dominance versus deficiency here. You could call menopause estrogen deficiency. But perimenopausal often is more estrogen dominance. So hormones continue to change from the time a woman starts to menstruate until menopause, and also beyond that too. So kind of basically adolescence, young women, children kind of going through adolescence, when they start having menstrual cycles, well, it's generally the estrogen that really causes this. And it's the maturation of the ovaries that allow this to happen. So now hormone production tends to peak at about age 25. And now again, realize that the ovaries, that's the main organ for producing estrogen. They also produce some progesterone, as they also produce the testosterone as well. So it's not just the estrogen. Now, from that time of kind of age 25 or kind of, let's say, late adolescence, to menopause, estrogen production actually remains fairly stable. The issue here is that progesterone actually steadily drops from about age 25 until menopause, and that leads to something referred to as estrogen dominance. So often we think of kind of a lot of the symptoms that are often referred to as perimenopausal symptoms, where, you're not at menopause yet, but you're starting to get these hot, night sweats, hot flashes type of things, and all these things they blame on, these estrogen going way up and down. It typically isn't the estrogen that's kind of going way up and down, although estrogen does fluctuate during a normal cycle. The issue there is that there's a lot more estrogen available in comparison to the progesterone, because progesterone drops steadily from age 25 all the way to menopause. And so again, we have kind of an in a relation to the amount of progesterone, there's too much estrogen. Now at menopause, the estrogen production then drops way down. That's what menopause is. Basically, the ovaries quit working. So then this leads to estrogen deficiency. But a lot of the symptoms actually come from kind of that estrogen dominance, when there's much more estrogen in relation to the amount of progesterone. And this little graph here just kind of shows that, progesterone tends to drop off sooner. The age of the individual kind of on the left-hand side is the younger individual, on the right-hand side towards the older individual. And as we get older, as women get older, and subsequently the progesterone drops much sooner, quicker than the estrogen does. And so now you have something referred to as estrogen dominance. There's more estrogen in relation to the amount of progesterone. And what's the problem there? Well, okay, it is part of normal aging, but poor balance of hormones can make a number of medical problems worse. So, okay, it's not just that, gee, you may get some of these perimenopausal symptoms, but it does tend to disturb thyroid function, because if you mess with one hormone, it always tends to affect a different hormone too. So it can affect that. So when the progesterone goes way down, potentially thyroid doesn't work quite as well. And what it does, it tends to increase thyroid binding proteins. And if we increase the thyroid binding proteins, even the same amount of thyroid hormone, if they're bound by these proteins, they can't function normally then. And so even though the numbers may look good, you actually may slow metabolism somewhat. It also tends to worsen insulin resistance. We talk about insulin resistance all the time. And this is one of the reasons why kind of women seem to be much more prone to insulin resistance than men are, even though all individuals eventually become, they become more insulin resistant. But women much more so sooner than men, and often this occurs kind of, if you want to call it a logarithmic step up, is that women tend to be much more resistant to insulin than men do. And part of that is the hormone imbalance here, which then, as we talk about all the time, insulin resistance tends to lead to weight gain. Now, it also tends to increase E1. Okay, now E1, which weight gain tends to do. So if we get weight gain tends to increase E1. E1 is estrone. The fatty tissue, okay, which if you're gaining weight, typically there's more fat. So the fatty tissue itself can actually make estrone. Why do we care? You think, gee, wouldn't that smooth over some of these problems? Well, likely not. And because estrone actually increases fat deposition. So if estrone goes up, it's easier to gain weight. And this is what tends to happen then as estrogen dominance goes through, and then eventually even menopause, then you actually have, in relation to the other estrogens, estrone tends to be even higher then. It can also be worsened by different plastics works, but now this was much more true probably a few years ago when we didn't know as much about the phthalates and the xenoestrogens, but still there are a lot of things that contain these phthalates, xenoestrogens, so subsequently then it can throw off the estrogen balance. And the problem there again is estrogen, it's going to be poor balance leads to symptoms. Okay? So the symptoms of estrogen dominance are often the symptoms that we blame on kind of perimenopausal type of things. Mood swings, anxiety, kind of emotional lability or weepiness, irritability, depression, panic attacks, insomnia, I'm not sleeping as well, pain and joint inflammation. You may get heavier periods, more bloating with the periods, more fibroids can be noted on the uterus, and that can be more on discomfort. Fibrocystic breast tissue tends to be worse. You tend to lose libido. Now, some of that is the testosterone dropping off as well. Often women find it's difficult concentrating. We have more cravings, especially carbohydrate cravings, headaches, weight gain, water retention. And these are all symptoms of estrogen dominance, which tend to occur then more so as age goes on, because again, progesterone drops way down. The estrogen doesn't really drop that far down until you get to true menopause. So what's the treatment then? Well, I mean, potentially, if you're still kind of having fairly normal cycles, then potentially adding a small amount of progesterone can help. Now, I'm not a big fan of utilizing progesterone to kind of help with the symptoms, and because progesterone actually tends to, a common side effect of progesterone tends to be weight gain, because weight gain kind of turns on lipoprotein lipase. I think we talked about this last week somewhat. The lipoprotein lipase turns on fat storage. Okay. Exercise helps. Exercise helps with all kinds of different hormone imbalances, is that kind of smooths over lots of things. Diet can also be very helpful. we talk for anyone doing hormone replacement. We have this discussion all the time in the office. I encourage anyone who's doing hormone replacement ought to take something called DIM, which is diindolylmethane. Diindolylmethane it's an herbal thing. It's in cruciferous vegetables. Cruciferous vegetables, broccoli, cauliflower, kale, Brussels sprouts, cabbage. These are the cruciferous vegetables. But they can be very helpful in kind of smoothing over some of these symptoms, but they also can protect you from a number of different things. For men, it can protect against prostate cancer. For women, it can protect against both breast cancer and uterine cancer. And part of that is, and I digress here a little bit, part of that is because DIM tends to force the breakdown products of estrogen down the right pathway. What I mean by that is, as estrogen breaks down, it can go along two different pathways, actually three different pathways, but still make it fairly simple or simplified, hopefully not oversimplified, but to simplify it somewhat. So as estrogen breaks down, it can go along two different pathways. One pathway increases risk of both breast cancer, uterine cancer, prostate cancer. The other pathway protects you from breast cancer, uterine cancer, prostate cancer. And so what we're trying to do is force it down, the estrogen as it breaks down, to force it down the right pathway. And DIM, diindolylmethane, helps do this. And this can be taken in supplement form. We have this in our nutritional store, which I encourage pretty much anyone that's doing hormone replacement therapy needs to take, because it can be very helpful there. All right, so what about estrogen deficiency then? Estrogen deficiency is basically menopause. The average age of menopause is like 50, 51, somewhere in there, but it can literally occur, 10 years before, 10 years after, and it can occur surgically if you've had your ovaries removed. Often we see, even if you just had your uterus removed but the ovaries left in place, my experience has been that many people, many women then will undergo true menopause actually sooner than they would have done. And it's because whether it's affecting the blood supply when we take out the uterus as well, maybe. But it does seem that women have had their uterus removed may end up going through menopause a little sooner than. The average age is 50 to 51. So now estrogen is often used to treat some of the symptoms of menopause. Now the big symptoms women often complain are the night sweats, hot flashes. But also you can get vaginal dryness, painful intercourse, depression, memory problems, decreased energy. Because the big ones that everybody talks about are, it's very obvious to people, or especially the women involved, is the hot flashes, the night sweats. So bioidentical treatment often is a good way to treat this. And probably estradiol is really the one that you need. Okay, the estradiol is really effective at treating this. The estriol, why does anyone want to consider even estriol at all? Well, because there may be a little protective effect against breast cancer. But again, what I find is actually almost more effective than is actually using that DIM, the diindolylmethane. Okay. Now, you also get other positive functions there. It can control menopausal symptoms. It can increase HDL, which is the good cholesterol, can decrease the LDL, and improve hair and skin, can reduce fine lines, can rejuvenate vaginal lining. That's where the vaginal dryness comes in. The estrogen can actually treat that. There aren't any really known negative properties. So is there really a downside? Not to bioidentical. And with synthetic hormones, then yes, potentially. It's probably more of the progestins, and progestins, a little different discussion. Progestins are synthetic progesterone, and progestins, what's often added to many of the birth control pills, but also kind of the Premarin, that often had progestins added to it. And subsequently, that's very likely where kind of when people talked about, is there increased risk of kind of from heart problems to strokes to kind of breast cancer to uterine cancer, it actually was probably the progestins that actually were the ones that were causing that. So kind of in summary, kind of wrapping this up a little bit, I know it's kind of 2 weeks in a row we kind of hit some of these things, but estrogen dominance, estrogen deficiency are very real potential problems. It's not in your head. It's like, and it is a part of natural aging for women. but that doesn't mean it shouldn't be treated. And again, if you are considering treatment, bioidentical hormone replacement, bioidentical, as we talked about previously, means it looks exactly the way your body makes it, as opposed to a synthetic hormone, which doesn't look exactly the way your body makes it. Okay, and that's where the problem comes in. It's the maybe a little sidebar that doesn't look exactly the same. Subsequently, that can cause these other problems that are associated with it. But bioidentical hormones, much safer. And it is something we do around here. We, one day a week, I kind of do hormone replacement therapy for people. We see many people for this. So if this is something that you're struggling with, it is potentially treatable. Center for Hormone Health and Wellness, at the website up there, which is www.centerforhormonhealthandwellness.com. And you can reach us here at the office. We got a slightly different phone number, but I'll go ring the same place. So if it's something you're interested in, we have flyers here. It is something that affects pretty much everyone, not just women, but affects every woman, but eventually men too, and refer to that as andropause, and but it still can affect pretty much everyone at some point. All right, questions. We kind of flew through some of this stuff tonight. But if there are questions, don't hesitate to pick up the phone, ask, or send an email, or next time you're in the office, we've got all kinds of information about it, or to be happy to talk further about it. Anyway, you should be coming in, getting your kind of body comp checked. I harp on this all the time, is that you want to make sure you're losing the fatty tissue, not losing the lean body mass. So get your body comp checked. You should be receiving the weight loss tips weekly recipes. Tune in each Tuesday, 6 o'clock for the next webinar. Watch your email for the invite and link. And remember, it's your life. Make it a healthy one. Have a good evening, everyone. Take care.